My name is Dr. Eltatawy. I am a UChicago vascular neurologist. So I deal with anything that has to do with blood vessels and the brain. So that would include things like stroke, as well as vascular malformations, aneurysms, things like that. I also have a subspecialty in subdural hematomas and see patients in a subspecialty specific clinic. The real reason why I ended up being a physician is because my father ended up very sick, and I was actually running part of our car parts business and working as a mechanic, selling car parts as well as cars, and doing a lot of that work when he got sick and ended up asking me on his deathbed to apply for med school, which I did basically 2 months after he asked me, and then he passed away before he found out that I got into med school, and then the rest is history. I've absolutely loved it, and he was right. It was the right move for me. Part of the reason why I came to University of Chicago is to start this subdural hematoma clinic. Subdural hematomas are a bit of a homeless disease. When they happen acutely, you end up in the ICU when you have this bleed in your brain on the brain. And then neurosurgery has the job of either doing a procedure on it and removing the blood or not. But a very large amount of these folks never actually get a procedure, and we don't have great medications for it. So many of these folks end up in limbo where ICU is not going to be following them up because they only work in acute care, and neurosurgery isn't going to be following them up because they're not going to get a procedure. But stroke neurology and vascular neurology is in this very unique position to treat these patients longitudinally, and a lot of the symptoms and disease processes that we are learning more and more about really do have to do with the vascular neurology of it. And so my job right now is to try and build this clinic out and to help start research that looks at these patients and finds better avenues for treatment. Most people meet me on the very worst day of their life. So you can imagine I see people at their very best and their very worst. I see people suffering relatively regularly. And these folks are scared, reasonably afraid of what comes next in their care. And it being the worst day of their life, it's tough to still think clearly on what comes next. My job is to think clearly for them if I can, to try and calm them, to be a consistent and knowledgeable and calming voice in those acute moments when the world is falling apart. Most people, again, meet me on the worst day of their life. So when you meet me in clinic and you walk into the door and I'm talking to you and not your family, those are moments that excite me because it means that I've gotten to you before the bad thing happened. And in stroke care, one thing about stroke is that when you feel a stroke and it truly happens, it's devastating. And who you were before that is no longer who you are now, whether that's your cognition, your memory, your ability to move, sensation, the ability to take care of yourself. So all these things can, in an instant, change literally overnight. And I think for a lot of these folks, I have the unique ability to make a change in their life or help support them in changing their life to try and reduce the chance that they'll have to see me on the worst day of their life.